time to check in and get some great information from Dr. Wagle, Dr. Jason Wagle with Kansas Perio and Dental Implants, Wednesdays with Wagle. Good morning, doctor.
Good morning, Ted.
Good to talk to you this morning, and I know we're going to get into a little bit of dental history a little bit. Is it true that dental procedures used to be performed by barbers?
That's right, Ted. For thousands of years, the most common dental procedure was the tooth extraction. Barbers performed that role for centuries, going back at least as far as the Roman times.
So how did barbers get that job?
Barbers had sharp instruments that they used for trimming hair and beards. Their skills were found very useful in preparing people for battle and tending to the wounded during wartime. And during other times, these skills were used to extract teeth and perform other surgical procedures.
So I guess you could go to the barber shop and get your hair cut and get your tooth taken out.
Yes, so to speak. And in the Middle Ages, barber surgeons traveled to community fairs to offer their services.
All right. Did barbers use anesthesia when they extracted teeth?
No, not for thousands of years. Anesthesia wasn't invented and widely available until the late 1800s.
Oh my! Well, when did the profession of dentistry then come about?
The medical specialties began to distinguish themselves from the barber surgeons in the mid-1700s. In 1723, a Dr. Pierre Fichard, a French surgeon, published The Surgeon Dentist, a treatise on teeth. He is credited as the father of modern dentistry. The first medically trained dentist immigrated to the United States in 1760, and the first dental school opened in Baltimore in 1841. I have the honor of attending UMKC Dental School, which opened in 1880.
And dentistry has made a lot of progress during that time, I would imagine.
Oh, yes. We talk about that a lot on this show, but, for example, anesthesia is now so advanced that we can keep patients very comfortable during dental procedures.
So, after all this evolution of the profession, what would you say now is the primary role for dentists now?
Ted, I think that the primary role of dentists nowadays is to save teeth whenever possible. At Kansas Perio, by treating gum disease, we help people keep their teeth, often for a lifetime. When necessary, we replace missing teeth with dental implants, improving function and the patient's quality of life.
So, we've talked about how the profession has evolved up to now. How do you think things will go in the future? How will dentistry continue to evolve?
Well, I think that dentistry will continue to see improvements in restorative materials, regenerative techniques, and diagnostic technologies. As these improve, I think that we'll see a greater impact of dental health on the patient's overall health, quality of life, and longevity. Dentistry and dental specialists like us at Kansas Perio will continue to develop due to this expansion of knowledge.
Interesting. So any closing thoughts on this subject?
Yes. We are very fortunate to live in modern times. There have been significant improvements in the delivery of healthcare over the years. Obviously, I don't cut hair, and barbers don't perform surgical procedures. This specialization and division of labor has been a great benefit to our modern civilization.
Yeah, I think I agree. It's a win-win on both sides.
Yeah.
All right. Hey, thanks for checking in with us. Have a great day. That is Dr. Jason Wagle, of course, every Wednesday morning at this time, Wednesdays with Wagle, sponsored by Kansas Perio and Dental Implants. When it's time to get serious about your smile, go to kansasperio.com. That's Perio, kansasperio.com.